Often when I talk to patients, they're unaware of the amazing things that we do in interventional radiology, but they are happily surprised to hear about some of the amazing treatment options that we're providing. Interventional radiology is an incredible field which provides minimally invasive procedures to patients across all spectrums of diseases. I think specialty recognition will help us increase our awareness in the community and entice patients towards some of the amazing work that we're doing.
With regards to the difference between diagnostic radiology as a specialty versus interventional radiology or interventional neuroradiology, the diagnostic radiologist is the person who would read the scans, report the scans, interpret the imaging, and provide a report based on that. We have more of a procedural role in intervention where we actually use the imaging provided from diagnostic radiology to plan and execute our intervention treatments.
We have emerged out of the College of Radiologists, but we are a long way from that point. And I think having a specialty recognition where we govern our own practice, define our own roles, and promote ourselves amongst our colleagues and in the greater network of what hospitals provide is really important. A day in the life of an interventional radiologist looks busy. We start early, we ward round on the patients that we've treated the day before, we make notes and make plans. Next stop is an MDT meeting where we're discussing complex cases and making plans for treatments in collaboration with our colleagues. Then we come to the department, we do a morning huddle, suss out what the day is going to look like, and then it's onwards from there. Innovations in medical technology is where interventional radiology shines. We utilise some of the latest developments to perform precision procedures which are minimally invasive and offer new alternatives to care that was previously not available to patients. Some of the technology that we are using is truly exciting. It's the reason why I got into the field. It offers patients minimally invasive procedures with incredible outcomes.
We can perform things previously thought to be impossible. Through minimally invasive pinhole access, we can do things such as open up blocked arteries, open bile ducts, ureters, all sorts of tubes. We can provide embolotherapy by blocking off non-useful arteries to shrink things such as fibroids and prostates. We can also deliver chemotherapy and kill cancers through the arteries.
Particularly aneurysms, vascular malformations, dural AV fistulas, all these sorts of pathologies in the past were typically treated by open surgery, where patients would have to undergo very long operations, spend many weeks in hospital post-operatively recovering from their procedures. Now we're able to offer treatments for these pathologies in a minimally invasive fashion, typically just a very small pinhole access in the artery and the wrist. They would stay overnight and then be able to go home the next day.
One of the unique things about interventional radiology is that we have access to some of the latest and greatest technology. This includes MRI intervention, CT, DSA and ultrasound. And we use a combination of these to perform precise treatments which are uniquely tailored to our patients.
With these imaging modalities, we're able to plan and execute our treatments very precisely, very safely.
Broadly speaking, our procedures can be done awake without the use of anesthetics and also without the use of operating theatre resources. In doing so, our patients will get faster access to care in a minimally invasive manner, but it will also take stress off the entire hospital system, allowing other patients to go through the system with reduced waiting times. All of this coming with a reduced cost to the health budget. RANZCR supports the recognition of IR and INR as distinct specialties within radiology. RANZCR emphasises the importance of advanced training, research and clinical practice by advocating a pathway to specialty recognition which will allow best patient care. IR and INR, I think, are the best specialties in medicine because we are on the absolute bleeding edge of technology in medicine, combining both the advanced imaging technology and device technology and synergizing them together to allow for insane procedures that are just in the realm of imagination previously.
There is a huge push for development, for refining procedures, Part of the attraction of interventional radiology is that there is scope to invent new techniques, to try new applications of old techniques. And that's what makes our field at the very forefront of medicine. It's challenging intellectually, and it's a career path which is exciting.